Hi, my name is Derek Moore. I'm a nurse leader at a healthcare facility in Arizona. Thanks in advance for letting me present a strategic plan for this class in tandem with my leadership position and company goals. The plan is to achieve 80% of the nurses at the facility to be educated to the BSN level or higher by the year 2020. The Institute of Medicine, IOM, is an advisory body to the nation on issues impacting health. In 2010, the IOM published a report entitled The Future of Nursing Leading Change Advancing Health. Extensive research from the report showed that for every 10% increase in the proportion of BSN nurses in a hospital's nurse staff, there is an associated 4% decrease in the risk of death. Other studies have shown better outcomes, better nurse retention rates, and a more satisfied nursing workforce. In light of the increased complexity of healthcare, the IOM has recommended healthcare organizations increase their BSN nursing staff to 80% by the year 2020. The central theme linking increased patient satisfaction and better outcomes with an increased amount of BSN nurses will be presented. The goal statement shows clear direction and desired results. Education is having an enormous impact on the nursing profession. There's an increased demand from hospitals, legislation, and academia for nurses to be educated at the BSN level at the minimum. At our facility, we'll need to be intentional about hiring, retention, and changing the culture to one that values nurses as lifetime learners. To do so, we need to know where we are and where we wish to be. So where are we now? At the close of 2016, we had 432 BSN nurses. That's 68%. 80% in 2020 would be an additional 76 nurses educated at the BSN level or higher, which is a 3% increase each year, effectively 19 nurses a year. An educational council would comprise of an RN manager, a BSN direct care nurse, an educator, a senior RN manager, director, librarian, and director of professional practice. Also, having the support of senior and executive leadership and directors would be imperative to the success of the project, especially to obtain buy-in for tuition reimbursement and partnership with academia and financial partners. The Educational Council and its members suggested will be invaluable in the proclamation and implementation of the 80% BSN plan. Additionally, they will send a delegate to a nursing conference sponsored by the American Nurses Credentialing Center to gain knowledge about nurse retention, attracting and retaining talent, in addition to nurse advancement and promotion of the quality of care. The Council and others will recognize nurses that have achieved a degree or obtained a scholarship via a company newsletter. They will advertise discounts at universities and inform staff of tuition reimbursement opportunities. Flexible scheduling will be promoted to attend school, and the Council will work with unit managers to help with this. They will recognize that there will be some apprehension in nurses returning to the classroom and offer suggestions and resources for financing and help with technology. Members of the Council will be talented at networking and persuading others. Using versatile methods of communication, they will promote and encourage higher education. They will have a significant role in fostering the education goals of nurses and the retentions of other nurses. A nursing theory will be chosen to provide the framework for a cultural change in the facility. Benner, 1984, established the novice to expert theory. Benner will become well known on campus, and in particular her beliefs that education and lifetime learning is crucial to patient outcomes. The marriage and the art and science of nursing will be promoted with increased clinical experiences for nurses in tandem to what they are learning in the classroom. The National Database of Nursing Quality Indicators, NDNQI, can determine if the increase in BSN prepared nurses has led to improved outcomes in nursing sensitive indicators such as pressure ulcers, falls, and catheter-associated infections. Nursing satisfaction data from the NQI RN survey will be used to find out if the RN's job satisfaction has increased. Studies have shown that those facilities that have a higher percentage of nurses will indeed have better outcomes in these departments. BSN nurses are well prepared to affect the safety and welfare of the greater community with their knowledge. The metamorphosis from novice to expert, Benner 1984, will provide nurses the confidence to do so. They will find that they have a newfound confidence and the political potential to lobby for change. They are poised to really make a difference, not just at the bedside. Thank you, classmates. Above are the references that I used. I welcome any feedback that you have whatsoever. It's been a pleasure having you in class these last 8 to 10 weeks.